Hi, Mrs. Ford. My name's Maddie. I'm going to be your nurse today. I'm going to walk in the room, do hand hygiene, perform my QSIN, looking for any obstacles in the way. She has 3 side rails up, a bed alarm. She has quite a few tubes. She has an IV in her left hand, an OG tube in her mouth. She's about to get a catheter. She's mechanically ventilated at the moment. She's not restrained or anything. We have her bed alarm on, the side rails up. She has her call light if she comes to enough to press it. So like I said, my name's Maddie. I'm going to be your nurse. The doctor wanted me to place a catheter, a Foley catheter in you today. So that's what we're going to do. But first I'm going to get your vital signs. So I would put gloves on. First I'd start with her temperature, which I don't know if I would get it in the mouth because she is intubated. So I'll do her axillary. Good, 98.9. Then I would feel for her pulses. They are 84 plus 1, I would say. And then her respiratory rate is 16, and that's automatically set on the ventilator. And then I would get her blood pressure. If it actually fit on her, so I'll just pretend. Okay, blood pressure is 124/68, so that's good. She also has an EVD, she also has an EVD that is measuring her intracranial pressure. So the doctor wanted me to put in a catheter, so that's what I'm going to do next, okay? Oh, her pulse ox is also 100%. So I've got my catheter kit right here. I'm going to spread her legs, open it up. This is going to be my trash. And then I'll put it right here. I will open this one away. Okay. I have my gloves on. Okay. So then I have this drape right here. It is sterile. I have my 1-inch border. This is actually the fenestrated drape because I don't know where my other one is, so we're just going to make do. Okay, I'm just going to drop that there and it's over her. So now I'm going to get my sterile gloves. I'm going to put them over here so I have an extra bit of the sterile field. Without breaking sterile procedure. I'm going to go up under this cuff and get this one on. And I'm going to fix it. Okay. So now I'm all sterile. This is sterile in here. I'm going to scoot this over. I have my 1-inch border without touching anything. I am going to take this off. Well, I'm going to test my balloon first. Okay, it inflated. Now I'm going to let it come back out. gonna leave that attached. I'm gonna get a little bit of my lube, put it right here, and then I will take this off. Put this in my trash. Stop. Okay, I'm gonna lube my catheter. I'm just gonna put it back in here. And that's all sterile. So now I would open up my iodine and I will put it in here without reaching over. And now I'm going to clean my patient. I will use this, my non-dominant hand, to spread her labia. And then I will do one swipe trash, one swipe on the other side of the meatus. One swipe, and then one right down the center, and then trash. Okay, I'm not going to move this hand. Now I'm going to get ready to insert the catheter into her. I'm going to kind of go underneath so it looks like I'm inserting it. So you're going to feel a little bit of pressure. And I will insert until urine is seen. I see urine, so now I will insert 1 more inch. Take this hand now and grab down here, and then I will inflate my balloon. Alright, it is inflated. So now I will do a little bit of a tug back, and then take this off, put it in the trash. So now she has a catheter, and I don't have to be sterile anymore, so I'll just leave it all hooked up. I'll pretend to hang it right here, and then I'll get all this stuff out of the way for now, because we don't need it. Okay, good job, Mrs. Ford. Thank you. I will be right back in just a little bit to do your assessment, okay? So then I would just document the date, time, procedure, what I did, what size I used. I used a 14 French. I'll have to correct my charting. I put 16, and that she tolerated it well, and that we put 10 mLs of sterile water in the balloon. Okay, so leave her in safe position. Hi, Mrs. Ford, I'm back. I'm going to do your head-to-toe assessment now. We got your vitals previously right before we left. So I'm going to perform hand hygiene, put on some gloves, and we will do your assessment. So, can you tell me where you're at right now? She's unable to tell. She's unable to talk. She's not opening her eyes for me. Can you move your extremities at all? No? Okay. She can't move her extremities either. So she also can't push and pull. She doesn't know where she's at. I'm going to kind of do a sternal rub to see if she'll respond to any painful... Stop. You need to stop. Any painful stimuli. Okay. She's kind of responding to the little bit of pain. So that's at least good. So I would rate her a 6 on the Glasgow Coma scale. Already did her vitals like I said previously. Oh my God, you need to stop. Sit over here. Sit down. Okay, I'm sorry. So now we will do her respiratory. We will listen to her lung sounds. She is mechanically ventilated. So deep breaths if you can. Okay, lungs sound clear. I will roll her over and listen to the back. Okay. She's obviously unable to tell me if she's been coughing, but she's been on the ventilator, so she's not coughing. So that is good. Her chest is symmetrical when she breathes. Like I said, she's being mechanically ventilated. So now I'm going to listen to her apical heart rate for a whole minute. Alrighty, her apical heart rate is 104 beats per minute, and it is regular, no murmurs that I could tell. So now I'm going to check her cap refill on all extremities. Less than 3 seconds. I don't see any edema. I will feel for her pulses. They're +1, kind of thready, which is to be expected with her diagnosis because it can cause hypovolemia, so a little bit of dehydration. So that is to be expected. She can't tell me if she feels any numbness or tingling anywhere. So, and as far as her pain scale, I can't quite tell if she's in any pain either, except for when I did the sternal rub. But she doesn't have any facial grimacing or any other expressions that I could tell. So, I don't see any JVD on her. Yeah, so, I mean, she could wiggle her toes and stuff with the pain that I gave her a little bit, but other than that, she doesn't really do much movement. I will listen to her bowel sounds. Okay. Bowel sounds are active in all 4 quadrants. I would say I'm going to palpate. Her stomach is rounded, it's soft, there's no distension that I can tell. Her last bowel movement for us was yesterday. She passes gas kind of frequently, but once again, she's unable to answer that for me. So as far as her genital urinary system, she also can't tell me if she's having any pain or burning. Even though she's not sedated, she's just not able to tell me any of those things due to her brain injury. So when I placed the Foley, I didn't see any discharge or anything down there that would be concerned. So I will assess her Foley. It appears we have had 180 out in the first hour, 240 out in the second hour, and 440 out in the third hour. So she's producing a lot of urine that's increasing. And it seems to be a pale, watery color, whereas when we first started, I didn't mention it, but it was more of just a regular yellow color. Still clear though. I'll take a look at her OG tube. If I was going to use it, I would check the placement. I would flush before and after using it always. I know it looks like it's in her nose, but this is actually her mouth. So yes, I would do all of that, but it's not hooked up to suction or anything, so it's just kind of hanging out until it needs to be used. I'd assess her IV site. No redness, no warmth, no swelling. Everything looks good there, and you'll see in a second when I flush it, when I hang the med. So she's also ventilated, which would come out, and that seems to be okay. If I had any issues, I would page respiratory therapy to help me out with that. So now I will recheck her vital signs to see if there's been any change because it's been a few hours. Starting with her temperature. Temperature is the same, 98.9. Feel her pulse. Pulse went up to 104, so that is an increase. Respirations are still 16 due to the vent. And her blood pressure is 108/56, so that is a drop from before we placed the Foley. And then her SpO2 is still 100. So now I'm going to take these gloves off, get some clean gloves. Hey, Mrs. Ford, the doctor has ordered that we give you some IV fluid. It's just regular normal saline. It's an isotonic solution. And we're going to run that at 75 milliliters in an hour. So I'm going to get that hung for you, and I will reassess your IV site and make sure everything's okay, okay? So I would also be sure to check her, since she can't speak to me and tell me her name and date of birth, I would check her wristband with the computer and also check it with the medication and make sure everything matches. So I will check my computer, it matches. Okay, so now I will check her allergies as well, but this is just normal saline, so she's probably not allergic, but it doesn't say that she's allergic. So now I'm going to get ready to hang this normal saline. And I will put some new gloves on, wash my hands. I already did all the checks that I need to do. Check and make sure it's the right med, right time, right dose. So first, I need an alcohol swab. I'll be right back. Okay, I got my alcohol swab. All right, Mrs. Ford, I'll swab. And I'm going to flush 3 to 5 ml to make, can't do that. I will get a new flush, but I only have one. So I'll flush. Okay, it flushes without issue. So then I'll get her medication ready. I'm going to hang it up here on her IV pole. And I'll open up the tubing. I'm going to clamp it. Pull this off without touching anything. Spike. Squeeze my drip chamber. It's empty, so it won't. So it's filled about halfway. Prime my tubing until it runs all the way down to the end, so there's no air. And then this is sterile still, so I will scrub this one more time. I already flushed. And then I will hook it up. And then unclamp again. And set my rate on my pump for 75 milliliters an hour. And I think that is all for that. She's got it going. The pump's correct. The flow rate is correct. It's labeled. We're good. Okay. I'll be back in a little bit to check on you, Mrs. Ford, okay? You let me know if you need anything. If not, I'll be peeking in a lot, okay? Okay, so now I'll wash my hands, leave the room again. Come back. Hello, Mrs. Ford, I'm back. I just wanted to check on you. The doctor wanted me to change your IV again to D5W at 125 milliliters an hour, but we don't have to do that because we just had to do this one. So we'll just verbalize that we would change it following procedure and checking the orders. And he also wants me to put in your OG tube 200 milliliters an hour of free water so we can get your fluids up and going, okay? Because you're producing a lot of urine. So to do that, it's not a skill that we have to do for this one, but I would just check my placement using my pH paper, and then I'd also do an air bolus, and I would flush 30 ml water before and after, and just be sure that I'd attach it to the pump after. So we would say that now it's all attached to the pump, and her Foley is good, and I think I did just about everything. So you're going to be getting a new nurse now. She's going to be coming on for the next shift. This is Mrs. Ford. She's a 32-year-old female. This is my report, by the way. This is Mrs. Ford. She's a 32-year-old female. She's here because she had a fall and she has an epidural hematoma. She has an EVD monitoring her intracranial pressure, which was last 15. She is also diagnosed with diabetes insipidus right now. She has clear lungs. She does have some hypernatremia for me, and a low specific gravity and a high serum osmolality. Right now she has D5W running at 125. She's intubated currently. She has an OG tube and it's running at 200 ml an hour with free water running through it. She only rated at a 6 on the Glasgow Coma scale. She doesn't even really open her eyes, but she will respond to some pain stimuli. She has a Foley and it has been producing quite a bit of urine for me. Right now her EVD is open and it's draining clear pink fluid at about 6 milliliters for the last hour. And her vitals have been pretty stable for me, but her blood pressure has dropped actually a decent amount. It's now 108 over 56, and her heart rate has increased to 104. She's a flow code. She doesn't have any allergies that are listed on her chart. And I think that's about all for her. She just doesn't really say, she can't talk. She doesn't respond hardly. So yeah, that's all for her. All right, thank you, Mrs. Ford. I hope you have a good day, okay? We'll see you when I come back in a couple days.